You're listening to a brief excerpt from Social Determinants of Health, Evidence for Interventions, co-sponsored by MCG Health. This webinar features a discussion about the foundational initiatives and activities designed to address social determinants of health and how MCG can help clinicians in identifying and providing resources for patients' social determinants of healthcare needs.
Hi everyone, this is Emily Ferguson. Thank you for attending our webinar today on social determinants of health. Our objectives today are going to be to understand the importance of social determinants of health, learn more about the most recent evidence for how social determinants of health impact different patient populations, and also identify future directions for social determinants of health. So first of all, we're going to talk about the definition of social determinants of health, or SDOH. And social determinants of health are the conditions of a person's immediate environment that affects their health. The World Health Organization defined social determinants of health as the conditions that a person is born, grows, lives, works and plays, ages in, and also the systems such as economic policies and social norms that influence that person's health risk and outcomes. Social determinants of health are strong indicators of disease complications, including mortality, that are responsible for many health inequities. This is becoming increasingly evident within chronic conditions and also in light of the COVID-19 pandemic, given the poor outcomes in areas that have more social determinants of health inequities. Some studies indicate that social determinants of health inequities contribute to 80% of poor health outcomes in chronic health conditions. The cost associated with poor patient outcomes has also soared, with readmission rates exceeding $41.3 billion annually in patients with SDOH needs. Social and economic factors have a more significant influence on a person's health state than clinical care. Publications such as the World Health Organization's Closing a Gap in Generations and also Healthy People 2030 highlight the need and goals of social determinants of health with recommendations to provide equitable health care for all. Disparities of health impact the economic stability of the United States and should be central considerations for all health policies and health practices.
You've been listening to a brief excerpt from the Social Determinants of Health, Evidence for Interventions webinar presentation. This webinar was co-sponsored by MCG Health and recorded on August 9, 2022. The full webinar included an interactive speaker presentation with audience Q&A. You can watch the full webinar video at healthwebsummit.com/MCG89. That's healthwebsummit.com/MCG89.